Introduce our last speaker of the day. Dan Lewi holds a MSc in psychology from the Liverpool University and spent his formative years working in the City of London, gaining experience in marketing, new issue funding, and e-commerce platforms in the banking industry. In 2011, his eldest daughter was diagnosed with a terminal illness called Tay-Sachs at the age of 15 months. Upon finding that there was no dedicated charity providing support for families affected with this disease, he set up the Cure and Action for Tay-Sachs Cats Foundation with his wife, and he now runs the day-to-day management of this charity. Since the charity was launched, Dan has been able to grow the Cats Foundation, so it now offers a variety of services to its family members, including equipment, respite trips, and funeral funding grants. The charity was also recently nominated as a patient organisation for a clinical trial in Tay-Sachs using gene therapy, and Dan is actively involved in this groundbreaking work. As a small charity, Dan has been able to gain experience in a variety of roles and has developed skills in fundraising, grant writing, and marketing. So let's welcome Dan.
Great. Well, thanks for that introduction. It's great to be here to kind of discuss the charity we founded called the Cure and Action for Tay-Sachs Foundation. Give you a very quick overview about us. We started in 2011, and the main focus is to provide support to families affected by two illnesses called Tay-Sachs and Sandler disease. They're very similar in what they do to the individual who suffers from it. And we also actively support the research into potential treatment. That's something really focused on. Now, our story, personally, I think is quite interesting, because we started the charity with a very, very clear goal. That was simply, we didn't want any family who receives a diagnosis to feel isolated, like we did on the day we were told our daughter suffered from Tay-Sachs. And also, actually quite important, was we started the charity, we had something called timing. We're in the right place at the right time. We'll go into a bit more detail about that as the presentation goes on. So, to begin with, this is why we started the charity. That's my daughter Emily. It's the day she was born in 2009. Like most children, absolutely beautiful as she kind of grew, it kept us on our toes. Here we are, that's us in Milan, eating ice cream, and it's a really significant photo because this is the last trip we had as a family before she was diagnosed with her illness. But actually looking back, and with hindsight, she was actually suffering from some of her symptoms of the disease. Now, it wasn't anything too serious at the time. It wasn't until Christmas we realised she actually had a problem where we took her down to the hospital, and as mentioned, she was diagnosed with Tay-Sachs, 15 months old, in 2011. Now, I could go on and on and on and on and on about the illness. I could tell you every fact that I can name probably most of the children in the UK for the last 30 years who've been affected by it. That's not why I'm here today. I'm here to talk to you about the charity itself, and to give you some key facts. It's a rare, very rare genetic condition. It affects 1 in 320,000 births in the UK. Although the carrier rate, this is a genetic condition, is about 1 in 300. There are probably 2 to 6 births that we know a year who are diagnosed with it, although there are misdiagnoses, so it could be more. And sadly, it's a terminal illness, and the children with the most severe form, called infantile Tay-Sachs, life expectancy is only 5, and the disease progression is they lose the ability to function independently. So they go from being able to walk, talk, and crawl, and eat, to not being able to do anything, and become completely relying on their parents. Now, the Cats Foundation, when we received the diagnosis, didn't exist. There's nothing worse as a parent being told that your child is going to die very young, and you have to prepare yourself that you're not going to see your child grow old. What was very difficult at the time as well, when we asked for information, because you ask hundreds of thousands of questions to specialists, is who can we turn to for help and support? The answer to that was no. There was no one that we could speak to or contact in the UK with advice on how to deal with the services you have and equipment and things like that, and what the future would hold for us. We've given the names of these two great charities. These are two in the US. The Cure Tay-Sachs Foundation, which is run by an inspirational guy called Ken Bin. The NTSAD is a long-established charity. As I said, there's nothing here. Now, this is a question we get asked a lot, is why? Why did we start a charity? Now, it's because of her, obviously. That's Emily now. That's a very recent photo. So she turns 5 in November. And in terms of how she's coping with the disease, she's doing really well. It's not just her. These kids, this is Isabel. This is Isabella. This is Hope. And Oliver. And Hope again. And there's more children. Sadly, some of these children are no longer with us because it's a reality of providing support to people affected by a rare disease. Now, we are highly motivated to support these families. One of our key things is we don't want these people to feel isolated. And then how do we do that? We provide them with equipment. There's lots of things the NHS provides, and I've got to say, anyone who knocks it, I think, is wrong. This is an amazing organisation that makes sure you get what you need. What we do is we provide the extras. There's things there, for example, Isabella was on a swing. Now, when she was younger, she liked to have a swing. So we, as a charity, provide her a specialist chair that she could sit on. Which is quite significant. So the Cats Foundation. Why we started? There was a need. There was a need in the UK for a patient organisation. That's the most important thing. The parents were willing to start a charity. Parents were not only willing to start, but were dedicated and were willing to make sacrifices to run it and to make it a success. We had family members who helped out. We had a core group of other families affected by the disease who all help us. And this is the most important one, is we have families who need support. There are families out there who actually need equipment. They need a support network. They need to be able to interact with one another. And as I said before, timing. We were in the right place at the right time. Little do we know when Emily was diagnosed, a lot of work had been going on in the background in the research of the disease. And in fact, 15 years worth of work was kind of coming to the end, where they were getting ready to start a clinical trial that could potentially treat the disease. For our daughter, too late. But for new cases, there is a future. There's a hope for them that one day they may be rid of the disease. Now, the team themselves were actively trying to find, as some of you may have experienced this, trying to find parents who are willing to start a charity, parents who are willing to dedicate their time, because they need us as much as we need them. They need the support of a patient organisation to give their work credibility and to give them access to parents and patients that could potentially use in their trial. And we need them because they're offering us a future, they're offering us an opportunity that we could rid them of this disease. Now, as I said, we are highly motivated because coming out of the meeting when your child is diagnosed is one of the hardest things a parent can do. To know your child has essentially no future. So we didn't want other families to go through that. And we were all willing to put the time in to establish a charity, to build it up, and make it into a success. So, this is back in 2011. This is the very first event we ever did. So that's 3 of us in our cheap cotton t-shirts, the Iron-On logo, doing the London Triathlon. We raised about £2 grand there. That money was used to provide, as I mentioned before, Isabella her swing. Now that's significant because we saw the effect that what we could do as a charity to one child. Our last big kind of gala dinner we held at Shakespeare's Club in London. It's a great venue. And it shows people that we want to bring everyone together to celebrate our success. We don't do these kind of dinners to raise money. We do it to celebrate the success of the charity, of our supporters, to let them know that we appreciate everything they do. Now, going out there and raising your name in the UK is important, and also internationally. So in 2013, we're actually invited to join something called the UK Holistic Patient Collaborative. Now this is a group of other small charities who represent loss and storage diseases, which Tay-Sachs is one of. And we basically represent these diseases to ensure they get the correct treatments and there's advancement of healthcare for them. It's quite a powerful little body. We also founded something called the European Tay-Sachs Charity Consortium. This is bringing together all the European Tay-Sachs charities as one, so we have this one voice together, because clinical trials by nature in the EU will not just be for the kids here, because it's a rare disease, 2 to 6 children a year diagnosed. Where we get the patients from, it's going to be from Europe. So we all have to come together so we can share information and potentially get patients. Here they are. Now some of these charities we actually helped establish. For example, in Spain, she found that Tay-Sachs was an underrepresented charity disease in terms of charities within the whole of Europe. This is important as well. It's bringing us and them together, so we are as one. And we hold European family conferences now. We're holding our second one in Disneyland Paris, and that's in the last 2 years we've been able to establish people from 8 different countries in Europe who before would never have known each other, would never have met, would never been able to share ideas, share treatments, symptomatic treatments, because it's all different across every country. That's very important. So we're a small charity, there's no denying that. It's a rare disease. We support around 15 to 20 kids at a time. That's because children pass away and new children are diagnosed all the time. And we rely on the support of the families who are affected by this disease. We've been successful though, we think. We've raised, for some numbers, we average around about £100,000 a year just in fundraising, and that's with a small charity. We provide over £50,000 worth of grants to research. This is in the last 3 years as we start to become established. More than that has gone to actually providing respite trips, providing equipment, all vital things that these kids need. We actually are in the process of organising the very first Tay-Sachs scientific meeting ever in Europe, which is going to be at RSM here in London. These are things that we think would have happened in the past, that haven't. And these are all things that, as a small patient organisation, you need to think, is there a benefit to it? Yeah, of course there is. Bringing together everyone in the UK and Europe who sees these children, because for us, we don't have a national centre, it's everywhere. Personally, I think that's better because it's such a rare disease, you couldn't expect people to travel all to one centre, but bringing them together without the families to discuss the disease progression, how they treat the symptoms, trying to get a unified plan. You know, we have to put this all into perspective. We're a small charity. Like I said, 2 to 6 kids are diagnosed a year, maximum. We have a core group of people who support us, but we want to grow. You know, how did we get to where we are today? How did we go from one little event, 3 of us, to suddenly earning over £100,000 just a fundraiser? That's not none of the grants we've received over time. It's something I like to call point of difference. We have to stand out. Now, my wife sent me a study, I've got the numbers here, the other day, and I can actually dig because I can read these out. In the UK, there are over 30 new charities a year started, 30 charities a day started. There are over 160,000 charities registered on the Charity Commission. And 3/4 of these will be like us, small charities with an income of around about 100,000 a year. It's mind-blowing to think there's that many charities. There's that many charities being started every day, and they all have their own support, their own people who want to make them a success. You have to stand out in the crowd. We are realistic enough, and we have been from the beginning, to know we can't rely on the families who support us, because you're tapping up some people with fundraising. You need to branch out. You need to stand out in the crowd. You need to make them want to support you. And you, as a patient organisation, can't sit back and think, you know, for us it's a tragic tale. It's poor children that lose ability to function. You need to be different. You need that point of difference. You know, as I said, the Cats Foundation, we realise this. And we have a very simple point of difference, is we will just target specific groups, different people who we think can help us with fundraising, help us raise awareness, and then use them to get more people to support the charity. You know, we have a football team. They pay different teams, and each team then makes a donation of like £20 per match. We have these going on all the time. We target the runners, like most of us do. You know, we've had thousands of people undertake running activities for us in the last 3 years, which is a ridiculous number. We did an event called the Cats 10K Challenge, where we had a different person run a 10K for charity every single day for a year. We had nearly 1,000 people do that in terms of events. We have golf days. We have people who do baking, people who do arts and crafts. Now, personally, we can't be involved in anything, because that would just be spending a whole day fundraising. And being involved in a charity and running a charity, you have to be able to get in and out of certain jobs and tasks. So So we just branch this out to our supporters and let them go with it. Let them feel that they're involved in the charity. So, one thing we are really keen on is making people feel that they are shaping the way the charity is working. For example, our respite trip funding all stems from the fact that someone who supported the charity knew a child affected by a different disease who had a trip provided by another charity. And that child got ill and couldn't go on that trip paid by the charity. And they said to us, it's ridiculous that they give them a set date and they couldn't change it. But for us, we agreed our children are susceptible to getting ill. So we just decided we'll give each family a fund they can manage. They manage their own respite. They manage when they want to go away and how they want to go away. They want to go away for a weekend to recharge their batteries as a couple. No. They want to go away for like a 2-week holiday if the funding we provide covers that. Go. Let them shape, because the worst thing as a parent affected by one of these illnesses is you lose control. And so we're giving the parents, because remember we're managing not just the children but the parents as well, control of what they're doing in their future has a big impact. So we get asked this a lot, kind of, what's our future? You know, where do we want to be? And one thing we were very clear at the beginning was our trustees are a mix of people who come from different businesses, but we decided we wanted to have a plan, a business plan, the next 3 years, 5 years, 10 years. Where did we want to go? Our long-term goal is we want to shut charity. We want to be able to say, there's early detection, there's early treatment, there is no need for us, because it would be pointless. Because no one's affected by the illness. There might be a pipe dream, but that's what our eventual goal will be. But we've planned, we've received grants from other organisations, we're going to continue doing that. We can now farm our fundraising out to different people who support the charity on a volunteer basis, or we focus more on the day-to-day running of support, of applying for grants. We want to continue expanding our offering in different ways, and for that, we can come up with ways on how we can support our families, but actually, they can tell us. So we engage in them to come back to us with ideas. One simple one was, as the disease progresses, the child requires more and more care, and it gets to the point where they need 24-hour care. And someone was complaining that they can never get on top of their cleaning. So once a week, some of the families will provide a cleaner. There's a small thing like that, so now they're no longer worrying, one, the house is dirty, the child pick up an infection, and they're not having to do the cleaning. They can spend time with their child. There's small things like that make a huge difference. And of course, our goal, primary treatment. We want to be able to say, it doesn't really exist anymore, because you can detect it, you can treat it,